Good evening, ladies and gentlemen who have joined us via multiple social media platforms, YouTube, Facebook, Twitter, Instagram, and also via the Dr. Fundi website. My name is Dr. Fundi Lenyati. I'm the host of this Dr. Fundi channel. Today, we have a special guest, Dr. Siviwe Mila. I'm sure to many of you, she is very familiar. She's somebody that the media is very, very in love with. You'll see her on TV, Facebook, on many, many platforms. But she's doing great work. So Dr. Mila is actually a woman of many talents and interests. And I just want to introduce her properly. Then you will know why we chose to invite her to just represent the healthcare workers as one of the frontline healthcare workers. She is a qualified medical doctor who obtained her MPCHB degree from the University of Stellenbosch. I'm going to ask her if she did her medicine in Afrikaans or in English or both. All right. So she got her MPCHB degree year 2015. She's been working as a doctor now. I think this is year number 6. Right. So that's her qualification. She currently works as a sessional medical doctor at Edenvale Hospital. And she's been doing that since January 2019 to date. She does work in clinics. She does work in hospitals. And all of those as a frontline healthcare worker. But the other interesting thing about her is that she's not only a medical doctor, there is some entrepreneurial thing within her. At some point, she decided that she must go and study business administration. And so she did a diploma in business administration with the Gordon Institute of Business Sciences. So we are talking here to a businesswoman, an entrepreneur, founder and MD of Impilo Healthware. So she is actually now showing us the stuff that she does. She's going to have to tell us, the inspiration behind, the scrubs, where did this thing of sewing start? Can you mix sewing and medicine and all of those kind of things? Right?
Yeah.
And, so she's both a doctor and a businesswoman, but she's also a healthcare activist. She's very much, into looking at how things can be done better in terms of work conditions for healthcare workers. So issues of health and safety, issues of working hours for healthcare workers, and other issues, of support of healthcare workers, especially during this time of COVID, are things that are close to her heart. She's also a board member of MWASA, which is the Medical Women's Association of South Africa, and she's been a board member for the last 6 years. She is also studying towards a diploma in public health. I can understand that, because if you look at the work that she's doing, she's all about educating the public about this and about that, and even challenging colleagues about this and that, how to break bad news, how to do it in a way that, your patients do not remember you in a negative way, years later. All right, so that's about Dr. Siviwe Mila. So in summary, woman of many talents and interests, frontline healthcare worker, healthcare businesswoman, and entrepreneur. She is reported to be somebody who wants to have a positive impact on health systems beyond the one-on-one interactions with patients. Right, so that's about Dr. Mila. I'm sure she'll share a lot about what drives her. Because what we are told here about her is that she loves focusing on innovative ways of delivering healthcare, especially in a country and economy like South Africa. So, Dr. Siviwe Mila, Welcome to the Dr. Fundi channel.
Thank you so much. Thank you, Dr. Fundi. Yeah, when you're reading that, I'm just like saying all of those, just like, when you are at a place and you're just like, is that you? Like, who are they talking about? But thank you so much. I'm very honored to be on your show and on your platform. And thank you for everybody that has joined us to talk about actually issues that are really affecting us as doctors, especially doctors that are on the ground, that don't have a platform, that are too tired to even talk to anybody, that literally need support during this time. I don't even know where to begin. Like, there's so many things that
I'm gonna ask you questions. I'm gonna ask you questions, Doc.
Okay.
Then you just flow. I'll give you time. No rush. This is unlike an SABC interview of 10 minutes. It's not gonna be a rush. We've got 60 minutes to talk.
Okay. That's good. That's lovely.
To represent the colleagues on the front line, the good and the bad, so that's what I want you to do. All right, now I've got a colleague of mine who's supporting me here. So if there's anyone who wants to ask a question to Dr. Mila, they must feel free to do so on Facebook, on YouTube, or even on WhatsApp. And the number for WhatsApp is 083 391 4106. 083 391 4106. All right. So if you want to ask a question about anything relating to the experience of a healthcare worker in the front line,
Correct.
One thing I did not mention is the fact that she's recovered from COVID-19. Is that right?
Yeah. Yes, that's correct.
Right. So earlier in the pandemic, she was talking about the anxiety of worrying whether you're going to get infected or not. But then I picked up later that she actually got diagnosed with COVID-19, and she had to stay in isolation. And luckily, she's back to work, and all her faculties, I think they are back. Hopefully, they are back. All right, so we're going to talk about that part as well. All right.
Yeah.
All right. So I think let me just fire the first question. Why medicine? Why did you choose medicine as a profession?
So, Dr. Fundile, just a little bit of intro. I am a last born of 3 children from a single parent, and I hail from Indaba Zase, Eastern Cape, Eqala, and growing up in that environment, it's either you're going to be a doctor or an attorney. Accounting was not even big that much. It was those, and then also like nurses, policemen, and so forth. And I've always had love for people. I've always had a love of helping people. And it was a matter of, good, why not medicine? I remember the first time I had an interaction with our family doctor. It was my uncle. It was in the late 90s. He had just come back from Cape Town. It was during the time of the pandemic of HIV and AIDS. And he was so ill, And I remember seeing my doctor actually, and Dr. Fuzan, you might know him. And I was like, you know what, I want to help people. I want to do this one day. And that's where it came from. That's where it stemmed from. But I won't lie. I remember in 4th year mid school, I wanted to quit. I didn't want to do it anymore.
Why?
I wanted to go study politics. I was like, you know what, I'll do well as a politician. But then I thought that conversation with my mother will never flow. I'm quitting med school, Mom. I'm going to go study political science, and then let's see how that goes. And also, I think what angered me was that after 4 years of med school, the only thing I would have would be a grade 12, matric only. Yes. And I had spent so long. So it was just like, you know what, let's just do it for another 2 years and at least have a qualification.
But your chances of being, when you are in 4th year, you only have 2 more years to go, Correct. So it's actually closer to the end than,
go starting something new. But at that time,
easier. 2nd year, 3rd year, I think that those are the more hectic years. From 4th year onwards, things, okay, I don't know.
Stellenbosch, it was different at Stellenbosch. Yeah, when it comes to the language part, we still had, I remember learning anesthesiology in Afrikaans, especially the big systems, cardiovascular, respiratory. Yeah, but yeah, we can continue on that. But so the love for medicine comes literally, if people know me personally, I love to go the extra mile. I love helping people. And hence, I thought in choosing a career that would be something suitable. And that's why I went for medicine.
All right. Well, then that sounds very great. So to you, it's a calling to be able to help other people. You know, we choose professions for many reasons. Sometimes it looks prestigious. You know, other people want other people, they want maybe the respect that comes with it. Others, they want money. There are many reasons why people choose a profession. So for you, it was about helping people, all right?
Correct.
And then money as a number two. Am I right?
Well, there's not much money though. Like, I don't know, maybe I've got high expectations, but I just, maybe in private, you guys are doing well. But like, in public, we're going by. We're surviving.
Okay, but you've got your side hustle. Maybe we might as well talk about it now. You know, how is it going? I mean, you make scraps, and you also model scraps, and you're gonna get more clients, after this, because you are, just tell us a little bit before we get to the core business of our discussion. This thing about you getting to set up the Impilo Health.
So I've always loved working with my hands. In high school, I did stuff like crocheting, sewing, and entering competitions. I've always, loved working with my hands. When I finished high school and went to varsity, medical school was a bit hectic. I did not have a chance to do lots of that. So I remember when I graduated and I started working, I was like, with my first salary, I'm buying myself a sewing machine. And I did that. And I started making clothes for myself. And I was just like, I want something that's vibrant with the scrubs. So that's how Impilo started in 2016. And it was mainly like me making for myself and more people wanted. So that's where we're sitting at. But like, we're growing. We're still a small company, but we're growing.
Well, I'll call you another day for us to just talk about business. All right. For you to tell us about the journey as an entrepreneur, which is a side hustle for you at this moment. But let's move on. All right. So getting to you now, this is your 6th year of practicing medicine. All right. And you've always, from the time you did your internship, ComServe, you were at Edenvale, and you are still a medical officer in Edenvale. What has been your experience? In one hospital for almost 6 years now.
Sure. The journey of Edenvale is just, I remember seeing the list. So when you're in medical school, they give you a list of hospitals you can go to. And I remember, I always knew I wanted to come to Joburg, because I knew I wanted to do more than just medicine. And I felt Johannesburg would be the great place for me to have those prospects. I remember seeing the list and looking at Gauteng, and I just saw Edenvale. I didn't know where the hospital was. I was like, I'm going there. So it's just been a great home. It's been a lovely place for me. It's not such a big hospital. It's not too small either. It has been a great balance for me with what I would like to pursue in terms of entrepreneurship and also still being in medicine. And on top of that, it allows me to work at the clinics as well around, because I'm working at Ekurhuleni clinics and also Nasrec now with the people that they needed around COVID. So it has allowed me to have that flexibility. But it was a great start to my career. And I think I have formed great partnerships and friends, lifetime friends from working there.
All right. And in terms of the diversity of clients or patients there,
the diversity of patients actually is quite vast, because remember, Edenvale services Alexandra, and Alexandra is known as quite a notorious township. So you get your gunshots, your stabs, and you still are servicing some of the people from Bedford View and Eastleigh. So like almost like the LSM, higher LSM, middle LSM. So you're literally mixing everything together. And even like some of your private clients that do come to us, maybe in a car accident, because we're also next to the N3, you must remember. So lots of accidents literally so it's literally all over. It's diverse. You'll be seeing in casualty, you'll be like stabilizing a neck, seeing a MVA, next thing you're seeing a 3-year-old with a tonsillitis, next thing you're seeing an 89-year-old with shortness of breath. Like it's really diverse. And I've liked that about it, that it has made me to be on my toes in terms of overall in my skills, be it pediatrics, be it geriatrics, or be it in the surgical discipline.
That sounds like you get a kick from variety.
Definitely.
Wow. Okay. All right. You know, you mentioned something about Alexandra, which is one of the townships that is closest to Edenvale. Now,
Correct.
about 2 years ago, Alexandra Clinic or Polyclinic, there was a situation there where, you know, Tsotsis, they followed somebody that they had shot, was rushed to ER, and they actually finished up that person at casualty. And that caused a lot of trauma to the healthcare workers who were working there. Now, you know, that kind of experience, do you guys have that kind of experience within, you know, Edenvale, or at least you have been saved from that so far?
Yeah. So, so far we have not had such a drastic incident at Edenvale, I could say. Whenever, also the nice thing about the location of Edenvale itself, Sandringham Police Station is very close to us, and we've got a great relationship with the police, and they're able to come and help with the security guard. So there's not been an incident as drastic as what happened in Alex. I know a couple of years, even.
Sorry, Doc. A few months ago, you put up a post about
it was it was not at Edenvale, it was somewhere else.
Okay.
It was
right.
one
you can say that experience.
Yes, no, I will. It was one of the Ekurhuleni clinics I work at. It's a 24-hour clinic. It's within Tembisa. So that's where that's where that resonated from. It was not at Edenvale. So one thing I can say about it, that Edenvale has somehow managed with the security company and the great relationship that they have with SAPS, that is very close by, that we are feeling safe. Yes, there's been incidents. I know during our internship here, there was one doctor who was threatened by a family to a point where she needed to even open a restraining order against the family. But besides that incident, I have not had any other one that has happened, maybe to my knowledge, as I'm not full-time there, only working certain days. And then, the incident I posted about a couple of weeks ago, I think it speaks to South Africa and how we deal with anger and whatever we're going through, and alcohol being one of the biggest drivers. I know many people just say like, the economy and alcohol, but I think we need to be really honest as South Africans that we don't all consume alcohol the responsible way. And that is the biggest thing that is leading into trauma. So that one night, it was a clinic, a 24-hour clinic in Tembisa, and it was a weekend, a 24-hour call, meaning you go in at 8 o'clock in the morning and you come out at 8 o'clock the next day, which is going to be a Sunday. So you can imagine being the only doctor at the clinic facility. You can't even go, and it's quite busy. Like you can't even go to the toilet. Patients will be complaining, we've been here. They're constantly going and eating, and you're waiting. And I think that's what people and the society really needs to understand, that if you've got one person that is working for 24 hours, the moment they go take a lunch break for 30, 45 minutes, then you are uneasy because of the time that they've taken. But if you think about how long they've been working, they literally need that break. Otherwise, they're not going to be as functional as they can be. So in this incident, at that time, it was a guy who came in, stabbed, and at that time, you're dealing with a lot of stab wounds. This guy was not responding to any voice, So then you do the sternal rub, like anybody else, to establish your GCS. I remember doing a sternal rub to this guy. The next thing was a fist, like he hit me with a fist. And this whole time you still asking, like, are you okay? Like, calling out his name, and he never responded. And you're like, okay, you drunk? And he was just very aggressive, like, no, I'm not drunk. And just like, it was not in keeping with the behavior. And at that time he had around about a zone 3 neck laceration, and which you can't treat at first. You can't. The only thing I could do is just put a gauze, put a bandage, send to Tembisa, unfortunately. And it was more like, I think we had about 4 incidents at that time. So that was him. I even have forgotten that he punched me. That's how hectic the call was. That it was only when you have to write for management and write the statements that the sister was reminding me. Then later on, we had a guy who had a laceration on his eyebrow, which is, you're not going to bleed out and die. But I know people are very impatient, and if you're in pain, you feel like you died. And at that time, we were dealing with a gunshot abdomen and lots of other things. So he was not willing to wait, and he was not happy waiting. And that was when the argument is, like, you know what, Baba, by law, we are protected. If you've been rude to us, and if we feel like that we can't just even reason with you, we've got a right not to treat you. You can go to the next health institution. And that's where he was like, yeah, I'm not afraid of you guys. I'll meet you at the gate. I can even, I'll get, and if like the institution where it is, it's literally inside a Lokshin. So there's no way of getting to the highway, because I live more in the northern suburbs, of getting home without going through the township in itself. So it was just all of those. And then later on, we had someone who was even banging the windows. And through this whole time, you're calling the police and they're not answering. And we're just trying to get in your senior on call and all of that. So the experience, I think, just showed me the cracks within the system. Because later on, when we had the recall meeting with management, they were saying that no, but police are supposed to be rotating in this institution every 4 hours. And that had not been happening for a couple of years. So it's one of those things, I think, that needs to be brought up. But that was the incident that happened, at one of the epilepsy clinics.
All right. Now, Doc, in South Africa, we had our first case of COVID-19 on the 5th of March last year.
Correct.
All right. So we are now on month 10, something like that, month 9 or 10, I can't even count. We've had our first wave, and we are now in the middle of the second wave. As a healthcare professional, healthcare worker on the front line, what has been your experience? Okay. What has been your experience as a healthcare worker, or what has been the experience of the healthcare workers around you? Because you may not have experienced everything that everybody else has, but in summary, what would you say has been the experience, especially at a mental level? But yeah.
Okay, so when the first wave hit, we did not know what we were dealing with. And I think at that time, everybody was just like, no, we think it's just going to be a normal flu, seasonal flu. Because I remember working at a GP practice as a locum, and everybody wanting to come in and get tested for COVID. And at that time, we're still looking at travel history and stuff. This is like around March, April, which were those things were quite important. But then when it came to around June, July, when even the symptomatology of the patients that they were showing changed. I mean, like people came in like with loss of taste and smell, and which was something that was not alluded to in March. And we just saw that this virus is evolving into something else in the way like patients were just presenting. And yes, no, definitely. And I think that in a way just you were tired, but you were still not sure of the beast that you're dealing with. And I think around about even in August, we were okay as healthcare workers. We were continuing, but we were okay. But I think since it has been like since November, December.
Wait, Doc, you're moving too fast for me.
Is it? Okay.
You're moving too fast. Remember, we had the first case, 5th of March, right?
Correct.
5th of March. Then we had the lockdown, the first lockdown on the 26th of March, all right? And then there was a steady increase. And then in Gauteng, we had our peak between the middle of July and the middle of August, right? I just want you to tell us, during that peak, middle of July to August, how was it as a worker? Because already that time, people were dying, healthcare workers were dying, a lot of them.
Yeah. So during that time, I remember like there are 3 cases. So in throughout medicine, I think even in your career, Dr. Fundi, there will be those patients that will always stick out for you. There's those patients that you'll never forget. And during this whole COVID time, I remember a lady that came in, diabetic in DKA, and you're just like, okay, maybe this patient's going to get better. The moment the patient was admitted and the children had left, she died within 30 minutes, and that sort of like just drains you. You know, when you're resuscitating a patient like in a DKA, there's so much stuff you need to do. You need to put fluids, you're doing arterial gases.
Doc. All right. Because some of the people who are watching us are not medical. Okay. So let's take diabetic ketoacidosis, right? Yeah.
Yes. Yeah. So one of the so when you've got diabetes is one of the life-threatening emergencies that a person can have. So this specific lady had one of those, and it's quite severe, and in ideal settings you should go to ICU or high care. However, in a hospital that is saturated with patients that only maybe has one ventilator, like the hospital I was working at, you tend to at times just admit the patient in a normal ward because you do not have a facility and can't send the patient out. So in this specific patient, she had respiratory symptoms, but then the biggest thing that you were looking at was the fact that she's got this emergency, this diabetic emergency. And I mean, she was swabbed, but like, unfortunately, she died within hours. And I remember even having a 38-year-old with nothing else, no comorbidities, didn't have anything going on wrong. He came in with fevers, like he was literally, but you could talk to him. And next thing I'm like, okay, go to X-ray, ordered an X-ray for him. When he came back, he was comatose. So those are the cases that like at the time you're just like, but what are we dealing with? You had people that come in literally, I can't breathe. And then the next thing, the person just crashes and unfortunately passes away. So the first wave, there were a lot of people that died. And I think I'm saying to be corrected, but I think we don't even still have the correct numbers because some of those results were not even out as yet, and some were not even as tested as yet by the time they present you shortness of breath and then they die.
Yeah, so, in fact, just to come into into that point, Doc. We obviously are getting the statistics every day from the National Department of Health of how many new confirmed infections and how many reported deaths or recorded deaths. But there's the whole issue that you've just mentioned now. People who die before they reach the healthcare center, and also those who die at ER, before they have actually been, tested. And so the numbers that we see are not a true reflection of the total numbers. So when it comes to deaths, there's what they call excess deaths, which is actually a huge number as well, where they're comparing the number of deaths that are recorded by, Home Affairs versus the ones that are disclosed as, COVID-19 deaths. Yeah. So now, you remember those cases. What does it do to you, at an emotional level, at your confidence level as a healthcare worker to have lives just, going like that? Because we are trained to save lives.
Yeah. So one of the videos that I posted over Christmas, I was looking at one of the institutions in the Eastern Cape. So people think that, when you're a doctor, like somehow you're a robot and you don't have emotions and feelings. I don't know, maybe they think that's how we trained at medical school, but we do not have that in our syllabus and curriculum. But you are a person, and what you said, that why we go into medicine most of the times and why we do our job is that we want to make people better and save lives. So when you have a life that is lost, and especially in that setting where you literally have people that are waiting for you. You have your team around you, like, you know what, guys, we did the best that we could. We resuscitated. Unfortunately, this person is dead. We need to move on to the next person. Like literally within about 30 seconds from declaring that person dead and speaking to the family, you need to see someone else. And you need to be a happy healthcare worker. You need to be understanding. You need to be compassionate. And yet at that time, you are just thinking of ways that what you could have done more, because that's how we trained. You are literally working in your head. What is it? Did I miss? Like, should we have done more things? Like, should we have, like, even, you always run through the case. And that's why at some hospitals, you just have like a nice debriefing sessions, but not everybody's fortunate to have those, and even like a psychologist, dealing with it. So I have literally experienced that you move from death to the next patient. Like literally, you just call next, okay, tonsillitis next, like literally, and it literally has an impact when you get home. That's why I think most of my videos are from the car, because like when I literally get inside home and I'm just like, what just happened? You know, in the last 24 hours, I have seen 3 dead people and I am not okay. Yes, I've treated everybody that needed to treat. I now need to go in my sanctuary. I need to rest. I need to get ready for the next day. But I'm not okay with those 3 families. I mean, those 3 people that have been lost in their families. And yeah, so it literally drains you.
All right. So that was the first wave. Already at that time, there was a limitation in terms of the resources. There were not enough resources to go around for each patient, right? Doc, are you still around?
Can you hear me? I think,
yeah, I can hear you.
Yes,
now.
I am. I think I just lost you there.
All right. So no,
okay,
what I was
sorry, my connection.
Right. So what I was saying is that during the first wave, at the peak, we started seeing a situation where there were not enough birds birds in normal wards, not enough ICU beds, not enough machines, not enough. What does it do to you as a healthcare worker where you have to then decide there are only 3 machines, high oxygen, flow machines or CPAP machines, or even that decision to say, I'm going to put this one and I'm going to let, I can't put this one on the machine. It's called rationing. That process is called rationing. You are choosing to see who is best, who will benefit best from this intervention compared to the next person. At that decision, I just want from you as a healthcare worker on the front line, making such decisions, what does it do to you?
So it's not easy. It's really not easy and it's not nice. Can you hear me?
Yes, I can hear you. I can hear you.
Hello? Oh, okay. Sorry, I'm just, I think, yeah. So it's not easy and it's not nice, Dr. Fundi. And I think, every time I always think that if it was my family relative, I would want someone to go all out. But at that specific time, you've got a 60-year-old, you've got a 28-year-old. Like, you just have to take that decision. You know what? You've got the 60-year-old has got lots of other things going on. We're gonna go for the 28-year-old who's got better chances of survival. I don't think we should be taking, I don't think anybody should ever be in that position. But unfortunately, in South Africa, we have got resource limitations. And I think when it comes to even choosing who to intubate and who to ventilate, what has helped me is being very honest with the families, because at times we can go on so much in trying to help and not involving the families and them understanding. And what I find is that most people, if you come to a level where they understand what's going on, they are much more accepting and they totally understand that, doc, it's nothing that you can't. It's not that you can't, you don't want to do it, but there's nothing more that you can do for our parent or our mother. Yeah. But also, I just feel like we could have been better prepared for the first wave, even with the bed situation, because even now, there were certain wards that were opened as COVID wards at certain hospitals, but then had to go back to the original wards. Maybe it was surgical or ENT, whatever it is. But it's not easy, and especially, what irritates, I think, us the most is the fact that you know exactly what to do, but you don't have the equipment, So it's almost even the knowledge that you have and the skill set that you have obtained in being a doctor or being a healthcare worker, you cannot execute it to save a life because there's not enough medication, because there's no equipment, or because somehow someone did not order or procure the stuff correctly, and now they're bringing you lower grade stuff that you can't work with. And then
I want us to talk about that. I want us to talk about PPEs and substandard quality of PPEs, which may have contributed to some of our colleagues getting infected, and some of them have passed on. Your view around that, because when you are leaving your house in the morning, going to do your job, there is a certain obligation that the employer has to ensure that you are safe, And also, you do not get any infections in the course of you doing your job. That's part of the law of South Africa. However,
Yeah.
the reality is different. The employer, most of the time, does not always adhere to those obligations. And so I want to, as a healthcare worker, when you are aware that there are such situations, you are going to war, but you've not been given, the tools to fight.
To fight, the weapons to fight, definitely. You feel disempowered. You feel so much disempowered. So with me having a skill set of sewing, especially with the gowns, I mean, you had gowns that only covered you till here. And I would, you'd be like sitting like, who got this contract? Who was sewing this? It's so sad that like in January, had you asked certain people about, theater gowns, about certain level of mask, what a surgical mask is, they would not have told you anything. But yet these are the people that we were procuring from. These are the people that were giving us stuff that we knew about while they know nothing about them. So literally you had like even like paper gowns that were just stripping off, where you were just, actually literally it's this very substandard. And even the quality of the sewing, you had sizes where when you put on the jumpsuits, they just start tearing.
Yeah. Wow.
Hello, Dr. Fundi?
Yes, no, I can hear you. I can hear you.
Yeah.
Yeah.
So it for me, yes. So for me, I honestly still feel that when the dust has settled, and with all the healthcare workers that we have lost, I really still think that there's going to be a process of restoration that needs to happen, and a process of even recalling and just finding out like which mistakes did we make. And even maybe some human rights organization can even go as far as even like taking some people to task in terms of that the people lost their lives because they were not equipped enough. But I think people right now we're so focused right now in saving lives. But I think when the dust settles, there'll be such conversations and there'll be such court battles.
Yes. So now, what is different looking at the peak of the first wave, and we are now in Gauteng, just in the eye of the storm, the second wave. As Gauteng, we are now recording increasing hospitalizations, increasing numbers that require much more intense type of interventions. So on the ground, what is your experience over the past 2-3 weeks?
It's the virus is much more fierce. It has come back. I don't know, having drank some energy drink, like it has literally come back much more fierce. Yeah. Like now, what we're seeing, like everybody that comes in short of breath, like you're just like, okay, so let me just check how are your saturation sitting at, what's your blood pressure, what's your temperature. And if you're sitting at a saturation, even if of like 90, like it's fine, you can go home. And I mean, in an ideal world, the moment you're below 94, you're in respiratory distress, Yeah. But like right now, because I am more worried about the people that are at 60s and 70s and 80s, I cannot be admitting people that are sitting at 90 and 92 because of they just 2% below the cutoff that we have. Yeah,
just a little bit about that. Remember, we're also educating a little bit some of the people who are not within our profession. So just a little bit about the oxygen saturation, the levels, what does it mean?
Yeah? Yes. So in your body, everything that you need in your body functions. The cells, they need oxygen to function. So the level of oxygen that we get in the air is about 21%, and roughly it's enough for everybody. So if you would check a healthy person's saturation, they'll be sitting at about 95, 96, even up to 99. The moment that you are not getting enough oxygen, your cells start to suffer a bit, and then and most of the time that the primary problem is in the lungs, because that's where we get the oxygen in the lungs, and then it's converted, carbon dioxide, you breathe it out, the whole thing that we learned in biology in school level. So when you are getting saturation levels that are below 94, according to world standards, that is classified as a respiratory distress. So you are a person that has got a lung problem and you need attention. Ideally, you need oxygen at that time, and then further treatment. Could it be antibiotics that we put in via a line?
Yeah.
So via the drip, which is, they work much faster than the ones that you drink, because the ones that you drink, they're not as strong enough as the ones that they put inside your body, inside your blood vessels. So that's just generally what it means. So when someone when they come to hospital and they're like, okay, umakhulu is sitting at sets of 60, you need to understand umakhulu has only got 60% of the oxygen in Zimbabwe, where someone else is sitting at 95, so they've got enough oxygen to give all the cells. So she is literally suffering from not enough oxygen going to the rest of her body. And how the body functions is that it will shift the oxygen to the most vital places, the brain, the heart, the lungs, the kidneys, and it will neglect some of the areas that it doesn't need to at that time to function, because it's on survival mode. And that cannot happen for a very long time. And therefore, that's why even with the experiences that I had in the Eastern Cape, where people were like, no, like 3 days ago, ukula. And you're thinking that if it was sitting at 96 3 days ago, that's why you're coming now with a dead person in the hospital, because they could not sustain themselves that long on 21%. They need at least 100% to help them. So that's just generally what the situations need. And that's the biggest thing about this virus, is that it is attacking mainly the respiratory system, and therefore people need extra support. And that's why oxygen is so vital right now in our hospitals and equipment.
You know, Doc, in the UK, they've been advising families to have a pulse oximeter and also, a thermoscan, as part of the tools that are within the home. Because for exactly the same reason, at least if people know, that their oxygen levels are getting below a certain level, and this means I must rush to hospital, it will save a lot of lives. But other people think, maybe when I wake up tomorrow, I'm gonna be better. And they come to your ER and sets of 60, and a bit of a challenge. All right, Doc. So that is now. So what are the other things that you've noticed, during this second wave, and specifically about colleagues? Remember, you were there in the first wave. We are there. I mean, again in the second wave. There hasn't been really a break. The same people who were in the front line are still in the front line. Leaves were cancelled in some places and all of that. So at an emotional and physical level, how are you guys able to get the energy to still be able to go out there and deliver your work?
Yeah, I could just say, sit anyway, Dr. Fundi. We are tired. It's not even just about being physically tired. When you think about waking up in the morning and you are just like, I don't have it in me. I do not want to go. And it's not just you. You get to work. Your colleagues are not okay. We are all not okay. Be it the nurses, be it the paramedics, be it the doctor, be it the radiographer. We are just not all okay. We are all emotionally drained, physically drained. And if it was, I made an analogy the other time that we just wish that we're in a soccer team where like reserves could be called in, to take over.
You mentioned something here about 6 months sabbatical of some kind, a shift for 6 months and another one.
Yes, that would work very well. Not even if 6 months, like even if just it's like 3 weeks. I know like people that are wishing to get COVID so that they can just be off for that 10 to 14 days. And I mean that's not a safe place to be in. That's not a humane or sane place to be in, that you're wishing for an illness because you just want some time off. And I think the biggest thing as well, we're getting so many of our healthcare workers that are getting infected. I mean, in the circles that I've had more than 3 people that tested positive and have tested positive again now, and how do you reconcile with being away from your family again? And I mean, during isolation, it's one of the worst things. I don't think we speak enough about isolation and what goes through your emotions. Even for me as a doctor, I felt like I'm losing it. You are the person that is actually knows what's going on into the body. But like at that specific time where you're isolated and having COVID, you are not resting, as people say, just rest and enjoy the time out. You are not.
All right. So, but in all of what you've just, shared, Doc, what kind of support, psycho-emotional support, healthcare workers, and here we're not only talking about doctors, nurses, like radiographers, and even porters for that matter, all the people in a hospital environment. What kind of support, is made available? You talked about debriefing in some places, but what kind of support is there for you guys?
Yeah. So, I mean, for me, social media has been an outlet that I go to and vent, and then the videos gain traction. But in terms of the hospital, I think management has not even cracked on how do we support these people. I think the shift right now is so much on saving lives and just make sure you guys just work. And that until something drastic or something like someone decides that, you know what, we need to focus on the healthcare workers, there's nothing that I am aware of that's currently happening. Yes, people will encourage you to speak to a psychologist, and many times you even have to pay for the psychologist. I mean, my psychologist I could not even get an appointment with her last year. I could only get an appointment later this month, and it's been almost like 2 months of waiting, and you still need to pay for that appointment yourself because you understand that you are not okay.
1,200
exactly
per hour,
correct. Yeah,
a lot of money
and so I need to make sure I need to make sure that in my spending, I need to make sure I've got that money, because I'm not okay. I'm not okay for getting back home and being a mother and being, a sister. I need to be okay for that. But I think the biggest thing right now is that we're trying to support each other. We're trying to encourage each other. But for some people, their faith has helped them a lot. And also family has been a big factor in, just friends just saying that we're thinking about you. And I think just within South Africa, what South Africans can do is just to see how they can make the load lighter in terms of stuff that don't need to be seen at hospital at 3 a.m. Like if you're coming with a back pain that's been there for 6 months at 3 a.m. in the morning, where you have a chance of picking up COVID and you have not even taken any analgesia, like be it Panado or be it, Nurophens or whatever brand there is. So those, we're dealing with the pandemic and the people, and yet you still have those people that require you to give of yourself, but then like, you are not urgent, you're not going to die now, you can wait to come back the next day, and they just don't understand that.
Yeah, Doc, earlier you mentioned the issue of being physically exhausted, emotionally exhausted, and there is this concept which is now been included in the ICD-11, which is burnout. All right, which basically is emotional, physical exhaustion as one of the key issues. Two, depersonalization, which is that feeling of being detached from your work. You no longer feel positively about your work. Sometimes you can even be cynical about your work. And then the third part is reduction in the quality of your productivity, and it sounds like there may be quite a lot of people who may be burnt out. They are at work because they have to work, but they are burnout, and burnout is normally a stage before it can actually, depending on the coping mechanisms, before it can actually become a mental illness. It's like amber. It's like amber. It's something that says if we continue on this path, there could be a problem down the line. So, what do you think employers should be doing around?
I think, I'm very grateful for such platforms, because there are people that have joined in these platforms, there are people that are in decision-making platforms that are in these platforms, and they need to understand that on the ground that their healthcare workers are not okay. Firstly, things that are literally tangible that people can be doing is that your line managers should be asking and actually engaging people in those talks. How are you doing? Yeah. Besides you being at work, I know you were late for 30 minutes. You've been late almost every day this week, but how is it going with you? I think it's time for managers to step up right now and look at the emotional element and look at the HR element of the people that they're leading.
Yeah.
And I think that can go a long way. Ideally, yes, you'd like people to take leave. You'd like people to go and relax at the beach, but it is not practically possible right now because of the numbers of healthcare workers that have died and healthcare workers that are off, and therefore you need more people. But I think the biggest thing is that management must literally be seen on the ground, that they are with their people, and that staff literally feels that, you're there. I remember when I tested positive for COVID, I literally had my colleagues and my boss, "Are you okay? Do you need anything?" That goes a long way than someone just being quiet and AWOL, and you can tell the person that, "No, I've been..." Exactly. They're just like, "When you're coming back, no, you're supposed to be reporting for duty at 8 o'clock. It's 8:30, you're not here." And they don't even know if you're complicated, if you were admitted. So I really think right now, I know it's asking a lot maybe, but that managers really, really need to look at the HR element, and they need to be empathetic and start treating people much more kinder probably than they did before, and allow for those conversations, even if it's 30 minutes on when you should be doing a handover round. Just sit down, have a coffee, social distancing, like, "Guys, are you okay? Can I just bring you donuts?" Those are the small things that are literally going to be encouraging our healthcare workers on the ground.
Right. So, Doc, and then sometimes you are off, it's a weekend, and you see videos of people who are breaking all the prevention measures. They are in super spreader events, and others are actually in denial about whether there's this thing called, COVID-19 as a disease. Others are flooding our social media, with conspiracy theories and all of that. And you are on the ground, and you know that this thing is there. This thing kills, and some people, are still saying, this is Bill Gates, whatever, this is Rockefeller, whatever. What does it do to you when you know that these people, they are not playing their part and they are making our lives difficult as healthcare workers?
Yeah. No, it's really, really sad. I don't know. I think that South Africa, like, this pandemic has truly showed lots of societal ills that we have, in that we do not like taking responsibility for our actions. We like shifting blame, and we like dependency, especially on the state, because you'll get people saying that, "No, like, but why isn't the president doing this? Like, why isn't the government doing this?" And yet this is the person who's not wearing the mask, the person who was, at a party and, like, no social distancing observed. So it's really sad to see that, because the moment those same people come to hospital being high on whatever or being drunk, and you tell them, "Please put on your mask." I had a big argument with this lady who was just like, "No, no one gave me a mask." And I'm like, "But when you left your house, you should have had a mask." And she's just like, "No, I don't, like, nobody gave me a mask. Give me a mask then." And it's just a matter of Uguti. I agree that, yes, I don't have a mask. Ideally, I've broken the law. Please help me with a mask. But it's this whole thing with the, like, you need to supply. And I really hope we can get away from that dependency. And right now, that people should know this thing is real. Yeah, definitely. And that this thing is very real and people are suffering. I mean, I lost recently a colleague and an acquaintance who's younger than me, and this person went to work, went to go save lives, and now has left a 1-year-old behind. And those are the conversations that, I have with myself, and just like, will I be able to come back home to my daughter when you are treating people that are ignorant and people that don't even want to play their part? You ask them to put on their mask properly, even in hospital. In hospital, people are putting their mask on their chin. I'm like, the biggest chance of you getting COVID is in this place that you have come to, more than at the supermarket, because I have patients that are lined up here with COVID. And every time you say that, it's just they will be looking at you at funny eyes and all of that. But I really hope South Africans can stand up and take responsibility, because it literally, as the president said, it's like we need to be on, like, it's on us to make sure that we really decrease the numbers.
Yeah. You mentioned that you come from a small town called Tala. By the way,
Yeah.
I spent a year there. I did my standard 7 at Lower
Wow.
Tala. You know, my dad
Yeah.
was a principal at Arthur Tsengiwe, which was a training college at the time. So I know that.
Yes.
Now, there's a town nearby called Engobo. So I've got a
Yes.
colleague who's just come back to work, about 2 days ago. He relates a story that at the local farm in Engobo,
When it's very full,
guys
no, but always so.
who have seen an opportunity to rent out masks. So you come in, you don't have a mask, and you can't be allowed in. And so this guy will give you a mask, 5 rand. When you come out, he gets his mask, and then another person takes the same mask and all of that. So, and the question is, what will it take for our people to understand the seriousness of what we are dealing with? You know, at some point, you know, people also need to, you know, inform themselves about this relating to this condition.
I don't know, Dr. Fundi, that, you know, I mean, there's constantly education everywhere on radio, even when a place like Engobo, like, you know, the Xhosa speaking radio stations are constantly educating people. So we cannot say the information is not there. And I'm just thinking now of those cases that are going to end up going to an All Saints hospital. And that hospital can't manage. Even East London is full capacity. I mean, Eastern Cape health system in itself is in shambles and going through its own problems. And therefore, if you're having people that are renting out masks in such a saturated place like Engobo, where like even or just on a normal day, not even in December, like you can't even go through the main street. You have to go in the bypass the roads. It's very unfortunate, but I think we should really continue speaking to the people on the ground. Like I remember having a conversation with my mother that you can't go to that funeral. Yes, it's someone that you know, you grew up together, but you can't go to that funeral. And you should not be calling me and telling me that you're sick because now, yeah, your daughter is a doctor, but you're just not going to that funeral. So I think we literally have to be that harsh and that strict with the people that are on the ground and the people that we love.
Yeah, sure. But then there are also entrenched beliefs. You know, the guys who die from COVID, you know, they are wrapped in double plastic and they are not supposed to be brought home. And that plastic is not supposed to be opened, you know, but in a number of, you know, areas in KZN and Eastern Cape, families insist on on those plastics being opened. They want to dress up, wash and dress up their person. You know, others, they go back and they assume the body because their person say, you know, they came to a dream on somebody, or they are feeling warm or whatever. So, you know, I mean, the challenge we are dealing with, the issues of tradition and those risks. And, you know, the same lady from Engobo tells me that a colleague of ours actually, you know, did that.
Sure.
His own family, he was leading that process of opening, you know, the plastic. And that colleague is you know, has passed on, unfortunately, you know, because
Yeah, I honestly think, you know, when COVID happened and the rules that were being taken and the lockdown regulations, a lot was not thought of in terms of the African context and how people grieve. I'm going to take you just a bit back in terms of even right now. Nobody's allowed to see someone in hospital right now. And you must believe African people, you know, like they'll be like, no, we saw our mother and so forth. The moment you leave your person in hospital, if they die, that's the last time you see them. And unfortunately, I think that we could have made ways of saying that only one family member is allowed to identify the body. We will supply PPE as a hospital. The person will sign an indemnity form that should anything happen, they will not be suing the state or taking responsibility in us bridging that gap. Yeah. And I think, unfortunately, those conversations were not had. And that's why you're getting people not happy about just burying because no one saw them. And already, because we had incidences, I know, for in the Eastern Cape, I think it was in East London, where wrong was, you're burying the wrong person. And I mean, if you just have like literally one family member, or even just maximum of 2 family members dressing that body, dressed in PPE, and understanding that there's a big risk of you contracting the virus, but it's better if you are covered up as you putting clothes on this person and your loved one, but they still have to have the plastic around. So I think like the House of Traditional Healers would have helped us a long way had those conversations been had, and that they understand that how bad it is. Because I mean, that plastic, that virus, the moment you open, like it's in mounts and mounts and mounts.
Yes. All right, Doc. As we work towards wrapping up our discussion, your views around the banning of alcohol. With here I'm focusing on trauma,
Yes.
and the impact of trauma, in the hospitals that you're working in. It was banned earlier, and then it was relaxed. That is the supply and consumption of alcohol. And on the 29th, it started again. And we saw for the first time in the history of Bara,
yeah,
empty trauma ward, something that has never happened in the history of Bara. Now, as a healthcare worker, who is on the coal face, what are your thoughts around the relationship that South Africans have, the abnormal relationship that South Africans have with alcohol?
Yeah.
Is it a reflection of people who are, escaping from a lot of psychosocial issues, and therefore they use alcohol to escape?
As a crutch.
I just want your thoughts around that.
So I think, there are a lot of people that are advocating for the economy, like, you hear the economists speaking. And I think South Africans, they need to really be honest we need to be honest with ourselves. Firstly, you've got the whole economic tiers, your high, middle, and low. And like most of the times, the people that are tending to be violent and abusing alcohol could be in the middle to the lower LSM. Yes, the people that, like, you are not getting a lot of violent people that are sitting in their Sentin homes coming to your emergency, coming with lots of stab wounds and gunshots. And honestly, I feel like even the companies, South African breweries themselves, they need to do a lot more on educating and making sure that they're responsible drinking. And which is, I think, is one of the big lacking things that we're having currently. And I think it's one of those things I'm still thinking about writing research paper with my public health, that there needs to be something done about alcohol. Yes, we want people to enjoy, people to have a nice time, but the fact that when you're drunk, you can literally have 2 people stab each other. Like at a hospital in the Eastern Cape, literally this guy on Christmas Day came in with his lungs literally coming out. Like, they talk about sucking wood at medical school.
Yeah.
So you need to stitch this person up, put him on oxygen, while that oxygen is being needed by a 58-year-old who's probably got COVID, and like you only have like 3 tankers in the whole hospital for oxygen. So alcohol, it's a very sad issue that we as South Africans are such a violent nation when we have drank alcohol, and that we rely so much on it. As much as it's a big economic driver, I think there's going to be better ways of making sure we utilize it and that we're still responsible.
Yeah. In fact, when one looks at the pattern of alcohol consumption in South Africa compared to other countries, we are typically people who are binge drinkers. All right.
Yeah.
Especially around weekends, especially around month ends, especially around big days. We are binge drinkers because in other countries, people are sort of more educated about responsible use or drinking of alcohol. But here, we drown ourselves with alcohol, and as a result, we end up doing things that put our lives and the lives of other people at risk. But let's move on, Doc, to the issue of vaccines for COVID-19, right? When you heard the president saying vaccination is going to start, and there'll be 3 phases, and the first phase is gonna be for healthcare workers. What went through your mind?
Yeah, like, with medicine, you've come to understand how, even as with all the information that you have as a medical doctor, you're just like, okay, do you want this version, or do you sort of like want the proof version? Like, like with drugs are always improving, things are always improving. So you're just like, if I had it and I still have immunity, can't I wait for the second, the second batch of cells is going to be a bit more improved than the first one. But in all honesty speaking, is that we need it. We really need the vaccine right now. We can just hope that they're not going to be a lot of side effects, which is, I think, people are worried about.
In the phase 3 studies, there are no major side effects. I mean, local irritation, a bit of headache, a bit of raised temperature, but nothing hectic. No one has had anaphylactic shock, from the vaccine. No one so far. And these are on the phase 3 trials, at least the 3 that have already been, findings have been made, the one, so that is Moderna, Pfizer, BioNTech, and also AstraZeneca. The one from Johnson & Johnson, the results will be coming in a few days from now. So on the 3 that we're talking about, I mean, by Saturday last week, about 18 million people across the world had already been vaccinated. Wow. And there was no major adverse effect. So, I mean, one says, we should actually look on the positive side. Obviously, there are phase 4 trials. They are continuing to monitor these adverse, events, so that things can be, monitored and all of that. So I think, it's actually, something good. But yeah, but I wanted to hear from you. And I mean, there's going to be 1 million coming in January and another 500,000 coming in February. But there's going to be stratification, though, in terms of who amongst the healthcare workers gets these vaccines first. So it's not going to be everybody at the same time. For example, those just hold on. I'm just trying to get the right information here so that I don't. Right, those who conduct aerosol type of procedures, aerosol generating procedures, who intubate, who ventilate, take COVID-19 specimens will be first online.
Yeah, definitely.
Right, we call that category 1. Those who are in direct contact with known or suspected COVID-19 patients, they're going to be category 2. Those who are in contact with patients who are not known or suspected to have COVID, category 3. And those who are not in contact with patients, on their day-to-day work, maybe the heads of departments, are in that group. So there will be 4. So I just wanted to hear your view. Do you think this is a good approach to follow according to risk stratification?
I mean, if those 4 categories, okay, maybe the last category, it could be in place, but I think you could have just summed it up in 1 and 2, because for the people that the moment you get into hospital, as they say, the person is going to be controlled doing the aerosol, it's most likely going to be the same person in all 3 categories. You're going to see the patient, you taking the specimen. If the patient crashes, you're intubating. So it's not like you're going to have 3 doctors or 3 nurses dealing with the same patient and doing the 3 options or the 3 criteria that they've listed. So I think as much as they've put that certification, it would have been just better to just literally say that, especially the people that are working in your outpatients department, your casualties, those are the people that are, because there are lots of numbers of people that you don't even know they're positive. And they're coming to get their chronic medication. Even in the clinics, we're getting high numbers, although you have not done a swab. But the fact that you have done a physical examination on that patient and that patient tested positive for COVID because 3 days later they went to hospital and you saw the patient on day 0 or day 1, and they're quite highly infective. So that would be my piece of knowledge and advice. But hopefully it will be enough for everyone when it comes.
But then this stratification, though, seems to be more focusing on nurses and doctors, those kind of people. I mean, there's beyond those people, there's other healthcare workers, porters, moving people from casualty to the X-ray department. They are exposed, and where do you categorize them? In that list,
Definitely.
But anyway,
No. I mean, if you remember, I think we had a conversation on social media about the report even of the public protector. I mean, we have positions of porters that are not being filled. So you're literally doing everything as the doctor and the nurse, like you're doing all those jobs. And I mean, I don't know. I don't know what our employment levels are looking at, but I would think that with 1 million vaccines, you'd be able to give all the nurses and doctors, and still have some. But anyway, maybe my numbers are a bit, but I don't think we have.
They're actually looking at all the people in the healthcare space. They think there's about 1.25 million of the people. So they've just got extra, that is the 1.5 million, But again, one has to also say, depending on the district where one is, because the most efficient districts will be able to deliver these vaccines to their people. I'm talking about the healthcare workers. But I'm not sure in OR Tambo district in the Eastern Cape or in where Tala is, or any other, some of the districts in other provinces. So I think there's gonna be still challenges depending on the capacity of the district, because the unit that will be driving vaccination is actually gonna be largely the district health system, across the country. All right, Doc. Is there anything else that you really want to focus on? Now, one thing I did not talk to you about, which maybe I should bring in at this point, for people who are working in companies, my staff here, we contribute to the UIF every month, okay? Every month, so that in the event that one of my staff members gets injured or acquires an occupational disease, because of the work that they do here, then they can be able to claim from the compensation commissioner, for their medical expenses, but also, if there is any residual, disability, or even death, they can claim. Now, I am aware that just before the lockdown, the Department of Labor came up with, something for healthcare workers, so that if they contract infection in the course of doing their work, they can be sorted out. However, what you are hearing is that people are not necessarily, I'm talking about the families of the healthcare workers who passed. They are left stranded, that avenue for people to be paid out, that is their families, because, do you think that there is a need for the Department of Labor? I know there's a colleague of ours, Dr. Nandi Pakasha, and I'm going to call her in one of the days for her to come and explain in detail the processes. Was I was aware even before lockdown that there is this, for healthcare workers, but the levels of awareness about how one is that, maybe there is room for communication. What are your thoughts on that?
No, definitely. I remember when even one of the big insurance companies, Sanlam, I think it was Old Mutual, sorry. Old Mutual came out and will be like, if you contract COVID or even die, we'd compensate you like a certain amount of money. I think they had kept it though to how many healthcare workers they were able to give that fund to. And probably they even reached that cap. But at that time, South Africa was at a point of being in solidarity, we want to support everybody. But it's so unfortunate that those people that are left behind that have lost their loved ones, they are dealing with a matter of, firstly, but they're grieving. And therefore the energy of going to the Home Affairs, of going to the claims office and finding, even at HR, and even maybe at times at HR don't even know what's the right process. They're like, no, go to the Department of Labor, and in labor you wait in queues. I mean, till to date, I contracted COVID, and it was in December last year, and yet there's not been any paperwork that has happened in terms of UIF or Department of Labor for me, even just as a medical doctor myself.
Have you reported it to your
Yes,
supervisor?
definitely. No, definitely. It was reported from the time that you can't pitch at work. You know, you need to say why you can't come to the call. So
and did they report to the compensation commissioner?
Yeah, so that's the thing, in the sense that the channels of how the process works, it's not so clear, even for a person like me. Although I've got my private health insurance schemes where like they compensate you if you cannot work, but in terms of how the department is going about, I think there's not been great awareness of that, and to a point that I don't even know exactly how I would advise someone in that regard. So I think the Department of Labor, it would be cool if, as you said, that, you know, bring someone that knows more. And more than anything, even the people that are at HR, like that, it is even the line managers, that your supervisor knows exactly what to do, the occupational, because you must remember as well, Doc, most of the times you don't focus on the occupational health element in our hospital. You know, you just about treat. Until you get a needle prick, then you need to fill all those forms you have never even seen in your life. Then now even there's this whole COVID thing, and I don't think the paperwork is going as fast as it should be.
Yeah. All right. Now, let me make a promise that I will be reaching out to Dr. Nandi Pakatha, and she can advise if there's somebody else that needs to be brought in, so that we can create awareness about what happens when somebody, you know, gets, you know, COVID-19 disease, and also some people are left with residual problems, you know, some disabilities, you know, after COVID, neurocognitive or even physical ones. So, you know, there must be an avenue for those people to be assisted. But anyway, I will advertise it once I've been able to secure her. All right, Doc. I think we have covered, we've gone beyond by 15 minutes, but it was an enjoyable, you know, conversation. Let me just ask my colleague, Nwabisa, to see if there are any questions that people have on the platform. Nwabisa, have you been able to get any questions? Okay, it does not sound like, let me see now. Let me check. It does not seem like there's anyone who has got a question, because I thought there will be a few people who wanted to just find out. But how was your experience of, you know, being diagnosed with COVID, and that 10, 14 days, how was it to you?
So the first day I had a headache, and yeah, you usually have headaches, but this time it felt like my eyes are gonna pop out. And I'm just like, okay, maybe I'm just coming down with the flu. And that day I was on call. And I remember just like going like, okay, it's fine. I'm just going to sleep it out and take some medication. On the Wednesday, I had slept the whole day. On the Thursday, still I was not feeling well. I'm like, you know what, let me just go get tested. Friday results came back and it's positive. I remember having to think that, okay, my daughter now, like, what do I do with her? Like, my helper. So there was lots, as much as you are going through the illness yourself, there's lots of logistics that you need to be working out in terms of isolation and how you'd be doing it at home. But more than anything, the body pains were unbearable. It felt like your muscles were moving away from your bone and from your tendons. You know, when I was trying to think about it in a medical way, what's going on in your body, like physiologically, what is going on, like where's the virus attaching to, like it was just, it was just, you couldn't explain it in words. You know, when patients come in and say like, no, they feel like their body is like crumbling. I sort of literally could identify with that. Fortunately, I didn't have any respiratory problems. It was mainly the headaches and body pains, but and the fevers of 39 and so. But at that time, you're really going through a lot. You're thinking, are you gonna have? Because also your days fluctuate. You have a good day, you have a bad day. You have a good day, have a bad day, and that's why I'm saying the way that COVID is really functioning, it's not like any other virus that we've come in contact with or no, because most of the times when you're doing better, you feel like throughout, person gets better. But it was literally making sure that you drink enough fluids, you're taking your vitamins, and you're taking the medication prescribed to you. But the biggest element was the isolation. When they bring your food and put it outside the door as if like you're in jail or you're a dog, like go fetch. And then every time when you're done as well, you need to say, I'm done now, I can come get the plate. And just even being confined to one area, like I'm fortunate enough to have a house where people could go to different rooms, that you don't need to meet up with everybody. But we think in places where people are living in 1 or 2 bedrooms and they don't have the luxury of doing that. So I think the isolation was the biggest part, as much as the social media, but the contact of touching, hugging your daughter, kissing the people that you love, so those are the things that literally also are not nice in having COVID.
All right. Doc, I've got 2 questions that have come through to the lady who is supporting me. Nwabisa, can you please pose the 2 questions to Dr. Mila?
Okay, Doc. We have 2 questions from Paul Madu. The first one, she says, so what I'm hearing is, let alone that there were minimal preparedness, there's also an issue of healthcare facilities that are not being equipped. Has this changed in our healthcare facilities since March to date?
Yeah, so thank you so much for that question. And sure, Mpho, the sad thing about it is that had you listened to the public protector's report on health and the different hospitals that they went to, is that the health system in South Africa has been in decay for a very long time. And it's very unfortunate that COVID was the one that's sort of exposing all of these elements and the problems that we've been going through as healthcare workers. And probably maybe we were not being advocates enough on raising these issues until now the public is being affected. There are changes that are happening, and in terms of but infrastructure-wise, it's very slow, because you must remember the Department of Public Works needs to come in terms of building the hospitals, adding more additions. And there have been like hospitals that have been closed down. Case in point, like Kempton Park was closed down. And now you've got patients that reside in Kempton Park being split between Edenvale and Tembisa. And Tembisa is already saturated. So in terms of healthcare facilities, we are still very far. We are just hoping and grateful. I think with Dr. Fundi also in the session that he had with the Deputy Public Protector, that, the recommendations of the office are binding by law. So we're hoping that we're going to be seeing something in the next couple of years. But at this point in time, our health institutions are really not doing well. You go to places where nurses and doctors literally go beyond the call of duty to make sure patients are alive, but the infrastructure is just not there. I mean, in the Eastern Cape, in one hospital, like syringes, like you'd get people having to reuse syringes. Those are just like small issues where it's a procurement thing, literally at a hospital that I was working with here in Gauteng, they procure the wrong gel codes. Every time you use them, it's either they go through the veins, but they're just clumsy to use, in a point where you end up poking the patient many times, and you're also using more of the material than what you're supposed to had they bought the right brand. So those are the issues that are there. And I think these conversations that need to be had, and that in management within the healthcare sector, unfortunately, many people that are in the leadership positions are not people that understand what goes on the ground in terms of when you're acquiring this ventilator, how does it function? When you are buying this line, this IV set, like how does it function? Is it clumsy? Is it able to give the best for our patients? So those are the problems that we have. Even a small thing like a stretcher. I mean, the beds that were procured for Nasrec, those could have been stretcher beds that can be utilized after Nasrec is dismantled. But now, those beds, you can't even wheel anybody for a resuscitation on. You can't adjust them to put them on Fowler's position. Yet so much money was spent on just acquiring a steel bed, but we could have literally looked at little specifications that can help the health industry post-COVID.
Yeah, actually, I talked about Dr. Nandi Pakatla. She's actually listening, and she actually would like to correct. She says there's a lot of misinformation out there around this issue. So I've just sent a link. I'm not sure if she's going to be able to connect.
To join us.
Or maybe we'll just arrange another day. But also the Deputy Public Protector is actually also listening as well. You know, so yeah, you've got a lot of audience about, you know,
Thank you.
and it's nice to know that people who are influencers or people who are decision makers are actually, you know, logging in and listening to some of these conversations. So, and there's a few other people who are actually just saying, you know, thumbs up to you. The Deputy Public Protector is saying, as a society, we need to help healthcare workers and do our part to stay safe and stay at home if it's not necessary to go out. We are sincerely grateful for their contribution, even beyond the call of duty. All right.
Thank you so much.
Public Protector. A guy called Lupiwo Lakanya Mduzana says, Kuni nonke healthcare workers, siyabulela. All of you healthcare workers who are saying thank you. Thank you, Dr. Siviwe Mila, for sharing your ordeals with us. Utito akusigelele. May God bless you. Right? Dr. Kashla says, I'm watching, Doc, and would really like to explain, as there is a lot of, you know, misinformation. So I've just sent a link. I'm not sure if she'll be able to connect or not. She says, I am multitasking, Doc. Let's schedule for some other time. So we will another time.
No, definitely we'll join that one.
All right. And there's Mpoma too, who's already asked you a question. So I won't take another question from here. There is Zintle Maswa Zimledle. All she says is that she looks so young, doctor, with so much qualification. How old is she? So a compliment. That's a compliment. People think that you should still be at varsity, not somebody with a work experience as a doctor, you know.
Thank you.
Yeah, but you know, people are happy to hear from a healthcare worker on the front line about the kind of things that you guys, you know, are experiencing. And let's hope that report from the public protector will put pressure. In fact,
definitely
not just the report itself, but their remedial actions.
Yeah.
You know, I hope there will be, you know, change, because unless the guys in the provinces go back to court, those things are binding, and therefore those things need to be changed. But the whole issue of occupational health and safety for healthcare workers needs to be, you know, taken to the next level, because since 2008, all government departments are supposed to have occupational health and safety programs with a policy, you know, signed by the CEO, you know, and with a proper health and safety committee that meets every month, you know, and with programs that are running all the time around the various risks that are within the work environment. And what we have seen with COVID is that many health departments across the country, you know, have not really done much in that area. The focus is on the healthcare workers delivering the work, but the issue of health and safety, which is an obligation in terms of the Occupational Health and Safety Act 85 of 93, you know, there's been no compliance. And I think Department of Labor needs to now go into the various hospitals and actually, you know, conduct audits there to see those who are complying and those who are not complying. And if hospitals don't comply, then they put, you know, some measures to ensure that there's compliance. So, Doctor, I want to thank you for your time. It's been, you know, a very interesting conversation with you. And I hope those people who have logged in have enjoyed every minute of it. This was just one frontline healthcare worker who gave us a well-rounded, you know, view of some of the challenges they are facing on the ground. And we'll continue to look at different ways to, you know, advocate for their, you know, interests. I'm not in the front line, but, you know, I employ people. We've got patients who come in here, you know, and so from time to time, yes, I do get, you know, to be exposed to these things. But I'm definitely, I think, at level 4 according to that category. But I'm looking forward to the vaccination program.
Yeah.
And if I don't get it through, the normal government program, my medical aid will have to sort me out. So medical aids
Yeah.
are actually going to be subsidizing purchase of vaccines for people who are not within medical aids by paying
Yeah.
a higher premium
Oh, wow.
the vaccine, so that the extra money is actually used to make more people to have access. So private healthcare, is not so bad after all. It's for the first time we're seeing them being involved in social solidarity, and may
Yeah.
this continue, because we need a closer working relationship between the public sector and the private sector. So I want to say thank you to everybody. Nwabisa, is there any other question before we release talk?
There is one from Malibongwe Gwele. So
Okay.
he's asking, what needs to be done to avoid the total collapse of the healthcare system?
Whew.
Oh no, that one needs a program on its own. Needs a program on its own. Yeah, but let me see what the doctor is going to say.
So you know what, Malibongwe? Right now, like, the heart of the people that are on the ground, especially within the state sector, those people literally give their all. I was involved in a conversation where someone was saying that it's very interesting that healthcare workers are only being recognized and seen now, yet like policemen, when they die, their kids are taken care of. Like, there's lots of support within the military and the police services, but somehow for healthcare workers, that's not been done. One thing I can say is that they literally go beyond the call of duty. And because of that, they have been keeping the healthcare systems going. So the collapse is going to be prevented by the remedial actions, by the public protector, which you spoke about, and the recommendations. But I think also the citizens on the ground, you have the voting power. It's going to be local government election in a couple of months if it's not going to be postponed due to COVID. But addressing those issues in our small town, in our location, we only have one clinic that opens 24 hours. And within that clinic, we can't get 1, 2, 3, 4, 5. Then when people put pressure, and if we look within our country, South Africa, how civil servants stood up, that's how we could get our democracy. If people can take ownership of their health and take ownership of their livelihood in terms of like being healthy and being able to access healthcare, we would see a change much more quicker than we are advocating as we're working on the ground. Because at times they'll be saying that, no, you guys don't want to work, just work with what you have. But if the pressure is coming from civil servants on the ground, saying that this hospital needs to be upgraded to have like 5 ventilators, we need an ICU, there's going to be much more change in a quicker level because there's political involvement than it's coming from the people within the inside.
Wow, you've said a mouthful talk. A last one from Paul. It's more of a comment than anything. Mpoma too. She says, where are the Cuban doctors? We last saw and heard of them in landing strip. I don't think she's expecting any answer from you.
But they are there. They are there.
Yeah. They are there.
Yes. So as I said, I work in Ekurhuleni district. So in the clinics that we work with some of them, and also in Nazareth, there's some of the doctors that are there. So they are there. They are working. They are there. I can attest. Yes.
Okay. Beautiful. Thanks for verifying that kind of information. She also says we can champion that. That is, I think, civilians.
Yeah. No, definitely. And one thing. Sorry, Dr. Fundi, one thing, I think in a way I'm grateful that the pandemic happened, although we're not happy about the loss of life, but it has literally put people to understand how important health is in South Africa and how it's been neglected over the years, because it's only when people are going through the time of literally going through maybe their loved one, or they have delivered a child in hospital that ends up being a CP because they were not, the theater was not working, like all the stuff that's not been happening. And that's why we've been paying such high litigations as the Department of Health. The fact that people understand right now that the Department of Health is going through a crisis of not having enough equipment and so forth for the people on the ground, I think that's really going to help us in the sense that they're going to be advocates for themselves, because at the end of the day, it's for them. We go to work to make sure that they're alive and that they're healthy and that they do better.
Yeah. So she says, this management needs to listen, Betuna, the problems are deeper because oxalayo, until we get to immunity levels as a nation, and then what? So I think she's basically saying different stakeholders need to also see what can they do to be part of a solution to the big challenges that have been exposed by this COVID-19 pandemic. All right, on that note, Doc, thank you very much. I appreciate that you spent 90 minutes of your time with us. You will get your YouTube, link so that you can share it on your platforms, I'm sure we will talk again about when you must come and talk about your entrepreneurial ventures. But for now, we're dealing with the pandemic. So it's something that we'll deal with at some other time. So thank you very much. And thank you, Nwabisa, for joining me on this.
Thank you.
I just wish everybody to have a healthy and safe, 2021. I know we were all saying, 2020 is gone. We hope that 2021 will be better, but 2021 has started on a serious note. And I think as a country, we need to, to continue to support each other, not just as families, but a lot of people are losing jobs. A lot of people, are going through difficulties. So that Ubuntu part of us as South Africans, we need to extend that. So if you are privileged in whatever way, just try and see how you can help those next to you. So on that note, thank you very much. And
ndingumamaya ugasa ntando nxebo lawo mfutha uzondwazi intshaba zingazumenza nto
hayi noko awulochipha mosgqirha uyakwazi nozithutha. Thank you very much.
Thank you so much, Dr. Fundile. Thank you so much to the viewers as well and the listeners and the contributions that they've made. And as I said, you know what, at the end of the day, they're going to be the ones that have to champion for Bombabu because we go there to save their lives. But if the powers that be don't want to listen to us, they're going to have to listen to them.
And who know what, I don't want to cause any more confusion. Your words are very, very clear. And from your mouth to the people. Yeah, thank you very much. Bye.